call this meeting to order. I would entertain a motion to approve the agenda. Thank you. Could I get a second?
Second.
And we need to vote. Peggy Buchanan.
Present.
Pat Bryant.
I'm here as well. We can't see a thing except
Okay.
each other.
I'll have technical people work on that, please. Amy Churchill,
Aye.
are you voting for the agenda?
Yes.
Cindy McMahon,
Aye.
Donna Pate.
Aye.
I hate you. Max Queen.
Aye.
And Ann Franklin. Okay, so the agenda has been approved. We have 2 board members joining by Zoom. That would be Peggy Buchanan and Pat Bryant. On the action agenda, at this time, I will recognize Dr. Baldwin and Ms. Swanger. Okay, the personnel report. I need a motion to approve the personnel report. You second?
Second.
In favor? Peggy Buchanan?
Aye.
Pat Bryant?
Aye.
Amy Churchill?
Aye.
Cindy McMahon?
Aye.
Donna Pate?
Aye.
Max Queen?
Aye.
And Franklin. Thank you. The personnel report is approved. So now we will hear from Dr. Baldwin and Ms. Swanger on the Buncombe County School Reentry Plan for August 2020. Thank you.
Are we going to be able to see this? Do you know?
Madam Chair, when I joined by Zoom, I was not able to see. So
Okay.
I think unless you go onto the Facebook Live or some other way, I don't think there's a way, but
I couldn't tell what she said. I heard it sounded like something about Facebook Live, but I wasn't sure.
Okay, that was Cindy McMahon, and she was saying that when she joined by Zoom, she couldn't see either, and Mr. Pace has entered the room to see what he can do.
I can see now. Thank you.
Uh-huh.
Yep.
Okay, good.
Madam Chair, will you pull the microphone just a little bit closer?
It's in my mouth.
We want to hear your voice.
Yes, sir.
I want to begin by noting that the single most consistent and constant factor associated with COVID-19 has been change, and change in capital letters. We are bringing to you this morning a revised plan of reentry as a starting point from what was brought to you earlier on June 30th. The recommended plan that we bring to you this morning encompasses the first 6 weeks of the school year. Before that plan is presented, I want to take a brief moment to thank each and every one of you for your commitment to communicate and collaborate with our local public health officials throughout this entire period of planning and decision-making. Likewise, you have been attentive to the communicated concerns of our teachers and community stakeholders. And I think you would agree with me, that has been a wide range of opinions and comments and concerns from our stakeholders. Through this effort, you have maintained a significant priority on the health and safety of our students and staff. We are all extremely proud of the fact that you, the board, mandated the wearing of face coverings for all K-12 students, staff, and visitors in our building, 2 weeks prior to Governor Cooper's statewide mandate. As you are aware, on June 4th, the governor declared that Plan B would be the chosen plan for reentry into the 2020-2021 school year across North Carolina. Each local school board, however, was given the right to determine a more restrictive plan for their particular school system to operate under. And in this case, that option would be Plan C. Our recommendation to you today has elements of both plans. While I will be turning this over to Mrs. Swanger for more details, this would be an overview of the operations for the first 6 weeks. First, I want to make you aware that 39% of all students across the district will begin the school year on August 17th receiving remote instruction through our teaching staff. They will be receiving remote instruction only at least through the end of the first semester. For the 61% of the students that did not choose the remote-only option, this is what their first 6 weeks would look like under this recommendation. For those students in kindergarten through 8th grade, they will be divided into 2 groups, either A or B, and for the first 4 days, beginning August 17th, will alternate days in the school buildings to meet with their teachers beginning at 8 o'clock in the morning and ending on a 2-hour early dismissal. For example, Group A would be physically in school on Monday and Wednesday and remote on Tuesday, Thursday. In contrast, Group B would physically be in school on Tuesday, Thursday, and remote on Monday, Wednesday. Friday, August 21st would be a remote day for everyone and would allow our teachers planning. We believe that this plan, and we're calling this Plan B Beyond, would allow our students and teachers to establish a more solid foundation for future learning and instruction, especially relevant to the remote learning component and before we launch them out to cyberspace. It also allows for our technology department to address specific laptop issues and exchanges or distributions. Beginning August 24th, and I think each and every one of you have a calendar that's available to you in your packet. Beginning August 24th and extending into a 4-week span, these K-8 students will be provided remote learning instruction by their teacher. And excuse me, that would actually be 5 weeks, not 4. Because again, this is a 6-week plan. Prior to Monday, September 28th, we will come back to the board with recommendations again that are based on consultation, just as we did for this meeting, with our local public health experts as we look at the local COVID metrics and data over the next segments of weeks. As I noted earlier, change and unpredictability represent this current crisis we are all under. What we have found to be true is that 2 to 3 weeks of the COVID-19 impact can be an eternity. On September 28th, we could easily find ourselves continuing on an all-remote instructional model, or could possibly return to a schedule similar to how we began. For those high school students not opting for remote only, they too will be divided into 2 groups, A and B, and they will alternate days in and out of the building, Monday through Thursday. They will meet with their teachers beginning at 9 o'clock in the morning and ending on a 2-hour early dismissal. This will allow that later start for high school does allow us some flexibility with our buses that may be needed, may or may not be needed. Fridays would be remote learning for both groups A and B, similar to our K-8 model. The primary difference is that our high school students will need to follow this pattern over 2 weeks. Why the difference? 2 reasons. First, because the schedule of a high school student represents 4 courses or classes each semester, each with a different teacher and subject area. Second, the multiple changing of classes creates significant commingling, exchanges in various areas of the campus as they change classes. And this can occur all across the campus. In order to allow each student to meet their individual teachers, it will take a total of 4 days to accomplish that for the high school. For example, beginning August 17th, Group A students will meet with their first period teacher. The next day, Group A would remain at home and receive remote instruction. On their return to school Wednesday, they will remain in their second period classroom. This pattern would continue into the second week, allowing Group A to connect with their third and fourth period teachers. Similar to the K-8 model, the weeks would be Monday through Thursday, beginning in the morning, again at 9 o'clock and ending on a 2-hour early dismissal. Likewise, prior to Monday, September 28th, which ends that 6 weeks, we will come back to the board with recommendations based on consulting with our local public health experts and a review of the local COVID-19 metrics and data on what the next segment of weeks would look like. As we recommend a majority of our instructional model to be remote learning over this 6-week period, there is clearly a concern from all of us regarding the highly vulnerable populations of students that may be disproportionately disadvantaged by the reduction in direct support that can be provided through remote learning. To that concern, we ask you, the board, allowance to have the discretion to provide in small sections of multiple students or even on an individual basis in the building supplemental instruction. And again, all of this would occur under very strict guidelines and requirements through the State Department of Health and Human Services. Again, in all cases, the requirements and guidelines that accompany occupancy within the building, whether it be adults or students, and on campus, will be followed. I would note considerable disparity in the reentry plans that have been finalized and approved by fellow school systems across the state. Bottom line, they are all over the place between B and C. For your information, the 6-week reentry plan that we have submitted to you, Plan B Beyond, is probably most similar to the Charlotte-Mecklenburg model, which they have labeled as B+. In closing, I do want to recognize that whether we operate under Plan B or Plan C, child care will be an issue for our parents. Our school system is collaborating with Buncombe County government to advocate and promote for increased options that will provide not only child care opportunities for parents, but tutoring and support for students during these possibly very long weekly stretches of remote and virtual-based learning. Over the next few weeks, the county manager and I will be communicating with leadership from the nonprofit sectors, including the YMCA, who's been such a strong partner to our schools in providing quality after-school programs. Likewise, we will be speaking with representatives from our ever-supportive faith-based community, in addition to business leaders and employers across the county. And for our parents, I would say, please visit our returntoloearn.buncombeschools.org webpage for future updates and information relevant to this issue, because we do intend to dedicate a section that would be available as we continue to pursue these opportunities and options out in the community. And I will be back after Ms. Swanger, because what you've also been provided with, which you requested, were regulations regarding face coverings that would go into effect. And so when Ms. Swanger is through, I'm going to be coming back and just reference a couple of components of those regulations.
Thank you, Dr. Baldwin. As you remember, last spring, we entered remote teaching as the result of the governor closing our buildings. It was a reactive response, and it was an emergency. Our teachers and staff did an excellent job beginning remote instruction within 48 hours. However, due to many factors, some beyond our control, consistency and rigor were challenging. Now, using those experiences, we are proactively preparing teachers and staff for consistent remote instruction. Dr. Baldwin mentioned COVID has required us to change, and change quickly, and we're doing that and expect to do that throughout the school year. Our district staff have collaborated to develop remote learning guidelines using an online management system, and those are Google, Seesaw, and Canvas, and provide specific pacing so that our contents are taught in the areas and the sequence that they should be, and provide assistance for teachers. This is new and different. Curriculum and instruction team have provided samples of schedules. What would it look like if we were in Plan B? What does a scheduled day look like for remote instruction? We're providing specific lesson plans that prioritize the content standards, because above all, we have to make sure our students are getting the best education possible. In addition, every student will have live instruction daily, and that's what we call synchronous learning. That means that students will be assigned times of day to talk with teachers and be in those classrooms, and that is key. Student attendance, regular grading procedures will also be in place. Again, we have to be more like school. We have to add the accountability measures. You have a new calendar detailing the beginning of our school year for Plan B and beyond. We are so excited to welcome teachers and staff back in August, on August 10th. We get excited this time of year, and this year more so because we've missed having our teachers in our buildings. Teachers will be involved in virtual training, professional development, and of course, those staff meetings that are necessary for planning. But an important element of this year will be a virtual Meet the Teacher event in which students will see their teachers. They'll begin to learn about classroom expectations, what will their days look like, and understanding the schedules and what that grade level or that content course looks like. Another significant part of the calendar is the onboarding launch that Dr. Baldwin mentioned. This time will be spent connecting with teachers in a controlled face-to-face setting, and that is invaluable. We have to establish a remote learning environment because, again, as he mentioned, change is constant. This year, we could go from Plan B to C to B to A, so we have to be prepared for all of those accounts. In addition to starting a very important teacher-student relationship, It is critical for teachers and staff to have time to ensure that students can access their curriculum. It's about equity. For example, if we are remote, all of our students need devices. Our third graders coming up will need to trade their iPads in for a laptop. So we have to see them face to face to be able to provide those devices and teach them how to access what they need to access so that school matters. The iPads that third graders turn in will be cleaned and re-imaged for our new kindergartners so they can start their educational journey in the most appropriate manner. Last spring, we were so fortunate that the majority of our students successfully engaged with their teachers. However, we must have all students engaged, so it's extremely important that we have additional supports for our most vulnerable students, especially if we are in remote for extended periods of time. Vulnerable students could include students having trouble with attending synchronous learning sessions. So, number one, are students attending? Number two, are those students completing assignments so that we know that they are growing proficiently through their content area? And is the quality of work up to expectations? So looking at student attendance, student completion of assignments, and is that quality of work where we would expect it to be? Students should be scheduling to meet with teachers during daily instruction via Zoom, or scheduled to come into schools for small group or in-person assistance. In this decision-making with COVID, we will continue to be creative and find solutions to better serve our students under whichever plan you choose us to be under. It's complex work, but we have our reentry committee members, we have principals and administrators, we've heard from teachers, we have curriculum staff, and we're all working very diligently to make the best outcomes possible for our students while keeping students and staff safe. I'll be happy to answer any questions.
Board, do you have questions?
Madam Chair,
Yes, sir?
this is Pat. I'm wondering if Suzanne or Tony, as we digest this information, could give us kind of an update or a rundown, and it may have been in there, but it was difficult to hear a lot of it, on Jumpstart, how that's gone, how that's looked. I know we were initially looking at that as a way for us to evaluate how Plan B might work across the school system, and I'm just wondering if we've had health issues there, if we've had just a synopsis of what that's been, who that is, how many of the 500 we projected actually showed up, all of those types of things related to Jumpstart.
Yes, sir. We had 500 students attend in-person instruction in 19 different elementary schools. And those students were first, second, and third grade students. We also had several, probably about 200 students that accessed instruction remotely in some form or fashion. Attendance was small in classrooms. It was scheduled to be small, with no more than 9 students to 1 teacher in each of those classrooms, so that 6 feet distancing can be observed. Students wore masks. Teachers reported having great instruction with what does 6 feet apart look like, how do we walk in line, how do we sit, how do we stand. A lot of teaching the first few days, a lot of reminding our young students, but quickly they learned, and they learned the route of their classroom, how to go to the restroom appropriately, and those kinds of functions. Learning was happening, students were engaged, students told us how happy they were to be back. Most of our classrooms we saw on average 5 or 6 students. Again, so very small numbers. A great time for us to bring small groups of students back to see that interaction daily. Teachers will tell us the harder part of their day was recess and walking out to recess, and then how to play independently instead of playing on playground structures or throwing balls back and forth. So some learning had to be done there, and we're continuing to work on those refinement of skills so that when we are in Plan B, we'll be ready for all of those areas. Did that answer your question, Mr. Bryant?
It did, thank you, with one caveat. What was the length of their day?
Their length of their day, they started about 8 or 8:30 and ended at 1 o'clock. Temperature checks and were in place. Students wore masks. They had breakfast and lunch provided.
Thank you.
They did ride buses.
Okay, other questions?
I have one question, Mrs. Swanger. It's not about Jump Start. Doing the remote learning, I think at the last meeting, I had brought up a concern from several parents regarding the fact they do not want their children to be so heavily exposed to the internet, computers, et cetera. So what kinds of plans are we going to have in place for those families who do not want to engage technologically, but do want to participate remotely, if that makes sense?
I think that as an educator, we have to be assured that we're providing instruction. And our best instruction, of course, is when every single student is before us in the classroom, and that can't be replaced. However, we are using these conferencing tools so that teachers and students can see each other and see their classmates in a very controlled setting. We're also using the research from the Friday Institute, and that's an educational innovation group that is located on NC State's campus. What is the most appropriate times for children to be logged on and engaged with a teacher? And for example, a kindergarten or a first grade student, it should be about 45 minutes per day. So that time of day, they should be connecting with their teacher, and then they go off of the computer to do independent practice. Then that independent practice is uploaded onto their learning platform so that the teacher can evaluate it and give feedback. So a parent will have to make that determination if that's what's best for their student. But that's what we will have to do to ensure that remote instruction occurs.
I have a related question. For those students who, because they live down in some hall or someplace, cannot, no matter how many hotspots we provide or whatever, really cannot connect virtually, what will we be able to offer to those students?
Well, Mr. Pace has done a terrific job partnering with agencies to provide hotspots. But we do know there are a couple of very remote areas that hotspots may not serve the connection may not be as good as
Right.
we would hope. We did learning packets, and we will continue to do those so that students have their work individually brought to them. Some of our special education students worked from learning packets, and those were done periodically and turned in, and then others distributed. So we have to make sure that we meet every single student need.
That'd also be an example of a student who may be able to come in into the small group instruction like you were
Correct.
mentioning.
Correct. High schools are serving as remote learning, or remote meal sites, and that meal site will continue under Plan B and beyond if that's where you choose. We want, and then also, if we're in Plan B, those alternating weeks when students are home, they will have the opportunity to go and pick up meals in their school community.
So in Plan B Beyond, when everybody is remote, only the high schools will be the sites for meals? Is that what you're saying?
Ms. Payne is looking at that to see what her guidance allows her, but that's where it is right now, and she'll expand from there.
Okay.
Is there a possibility that we'll be able to do the Meals on Wheels type?
We would like to do that, and that's been requested. It will depend on the funding structures and state regulations for use.
And so that's how we got around it in the spring, was the Emergency Act?
Emergency, so we could use yellow buses to transport meals.
Okay.
Other questions? All right, Dr. Baldwin?
Madam Chair, we'll have time for discussion after there's a motion. Is that correct?
Correct.
I do want to bring your attention to the regulations that I've provided you, and I will say that what you have in front of you has been vetted by our board attorneys as well as our officials at our local Department of Health and Human Services. And what I would like to do is emphasize especially three components of this. And the first is the three overarching guidelines that essentially state what you, the board, has mandated, which now aligns clearly with state requirements. The North Carolina General Assembly has mandated that all school districts must be in compliance with all required COVID-19 guidance related to the operation of elementary and secondary schools issued by the State Board of Education, Department of Public Instruction, and the Department of Health and Human Services. Therefore, Buncombe County schools will comply with the core language noted in the Strong Schools NC Public Health Toolkit, K-12. Face coverings must be worn by all students from kindergarten through 12th grade, and all teachers, staff, and adult visitors on buses or other school transportation vehicles, inside school buildings, and anywhere on school grounds, including outside. Buncombe County schools will also commit to providing training materials for students and parents. Students will be educated on the reasons for and proper use of face coverings. Parents will be encouraged to reinforce this information at home. And I would say from my standpoint, in many discussions with our public health experts, that the three W's, and that is the spacing that falls under weight, that is the washing that falls under regular, consistent hand washing, it is the wearing of masks that they continue to emphasize over and over again. So this is extremely important, and again, I applaud this board for making that decision and that mandate early. I'd also like to reference what is a face covering. A face covering is a covering of the nose and mouth that is secured to the head with ties, straps, and loops over the ears, or is simply wrapped around the lower face. And I have one of those models to demonstrate. A face covering can be made of a variety of synthetic and natural fabrics, including cotton, silk, or linen. A covering that contains a transparent clear panel is an acceptable form of covering that may accommodate a variety of communications needs. And I brought an example of that because I want you to see it. As we looked at Jump Start, it was extremely valuable for our teachers' mouth to be seen, especially in terms of teaching that literacy to young students. And so this is an example of just one of many examples of that transparent covering. And again, I can speak. You see my mouth. And I think, again, from an instructional standpoint, that is a very valuable tool. We're in the process of purchasing a number of those, especially for our staff. Face shields may be used in conjunction with a primary covering over the nose and mouth. And we've had much discussion about the topic of face shields. Current evidence shows that while a face shield can protect the wearer from infection, there is no evidence at this time, and again, remember the keyword change, that a face shield worn by itself prevents the wearer from spreading infection to others. Therefore, the CDC does not recommend face shields as replacements for face coverings. clear face mask, such as I showed you, can be utilized in situations where visualization of the mouth is important. And again, the example we give in those regs is staff working with young students who are learning pronunciation, students for whom English is a second language, individuals who are deaf or hard of hearing, and those with behavioral concerns. If a clear face mask is unavailable and needed for one of these situations or something similar, use of a face shield by itself may be allowable. An exception to that combination of face shield and covering for nose and mouth must be approved from a district level administrator in advance of working while wearing a face shield by itself. The face shield, if approved, must wrap around the sides of the wearer's face and extend to below the chin. And then we put a note in there concerning certain masks that through our public health experts, they are reserved for more medical hospital environments. And the last thing I want to recognize and read per se is, are there exceptions for wearing face coverings? And the answer is yes in these regulations. All of the following must be approved by the school building level administrator or supervisor. Students, employees, and visitors may not be required to wear a face covering if they have a documented medical or functional behavioral issue, such as a disability, in which they cannot tolerate a face covering due to the medical or functional behavioral issue. The parent or guardian of a student that cannot wear a face covering due to a documented medical or functional behavioral issue should obtain any necessary documentation from their health care provider and notify the school building level administrator immediately for consultation regarding an acceptable accommodation. They may also not be required to wear a face covering if they are actively eating or drinking, are strenuously exercising and able to maintain 6 feet or greater distancing from other people. We saw that in Jump Start, actually jumping rope. Are seeking to communicate with someone who is hearing impaired in a way that requires the mouth to be visible. Are giving a speech to an audience, and you have the model in front of you and me, would be at risk from wearing a face covering at work as determined by local, state, or federal regulations or workplace safety guidelines, or have found their face covering is impeding visibility to operate equipment or a vehicle. And finally, have the permission of the classroom teacher and or building level administrator during scheduled breaks not to exceed 10 consecutive minutes in length to allow removal of face coverings when social distance requirements can be consistently maintained. For example, when people are stationary, consistently 6 or more feet apart, and refrain from extended conversation or producing high volume sound. And again, all of these exceptions, we consulted at length with our local public health officials to make sure that that clearly met their guidelines from the state level. Any questions on the regulations that you have in front of you? And again, if you recall, this was a request that was made at our last board meeting for our district level staff to bring to you. Mr. Shatley, I don't want to forget you. Is there anything from the board attorney standpoint, because I know you vetted these as well?
No, I mean, I think that about covers it. And certainly, they're happy to answer any questions that board members may have.
I have a question. It's not a legal question, and maybe it's more of a comment, but just thinking about the enforcement of wearing masks and that hoping that this can continue to be an educational approach rather than a disciplinary approach. And when there are students who are refusing to, if we can, as much as possible, deal with it from a restorative perspective, how is it that you're affecting the rest of the class and the students around you if you're not wearing a mask? What I would really hate to see is that because this is a rule and teachers want kids to follow a rule, that all of a sudden our discipline numbers go through the roof, and especially are disproportionate towards those groups of students potentially who are experiencing this virus disproportionately. I mean, this could quickly become an equity issue in my eyes. So I just, what are your thoughts about discipline and enforcement?
I think that's actually addressed in those regulations. We talk about the enforcement of this policy, and the first step is the education piece. And this is where I think that outreach over the next 3 weeks to parents is going to be important, because we need their help at home. This is serious business. We want to keep our students safe. We want to keep our teachers safe. But I think we also need to remember that we as adults are probably going to find ourselves reminding each other at times inside that school building that, oh my gosh, you forgot your mask. So I agree with you wholeheartedly. There's also recognition, especially at the primary and elementary level, for those young students that it is an education piece that's very important. And that's different from an open defiance. But we tried our best to address those in the regulations, also understanding that the school, it's going to be school-based in terms of that administration and faculty and staff to enforce, to educate and enforce.
And when we do have students back in the school building for an extended period of time, whenever that may be, I hope that we'll get some updates on how that's going with the mask wearing and discipline and so forth.
I can tell you that from the Jump Start standpoint, again, that was a very localized, specific group and age of students that, from my visits through those campuses, that our staff, our faculty and staff, our parents, and our kids did a good job.
And Dr.
Man, I'd
Baldwin,
like
can I
to-
add to? I'm sorry. I'd like to just add on to address Ms. McMahon's question. Is that I mean, I certainly believe a Hearts and Minds campaign is the appropriate way to communicate and try to kind of build buy-in for this requirement, especially for that first week of school for K-8 and 2 weeks for high school when they are going to be in the buildings. I want to also add, too, that as part of that, the state has provided each district with a certain number of face coverings for students as well, to assist for students who don't have them or cannot otherwise afford them. So we do have that potentially available as well. And third, I also want to just point out, too, that certainly I think Dr. Baldwin mentioned open defiance, but there is always just the option of doing the virtual remote learning for parents who don't want their children to wear a face mask, or for children who are going to refuse. And so, I think it's the hope, too, that it will not become a disciplinary function. It just might become a transfer into that kind of setting. Now, but again, I don't disagree with anything you said earlier, and fully support, and that's the way I think we're going to do our very best to try to address it. But just wanted to throw out those other points, too.
I think this is a wonderful opportunity when we are back in that building for our student leadership to express itself, because that power of what the students themselves model, along with our staff, is going to be extremely important for this.
Other questions from board members? Hearing, go ahead.
Just thank you for allowing me the opportunity.
Oh, certainly. At this time, I need a motion to approve the Buncombe County Schools modified reentry school plans for August 2020 as presented to the board today. Could I get a motion?
So moved.
Thank you. Could I get a second?
Second.
Thank you. All those in favor?
Can we have discussion first?
I've got to have discussion. In between that and calling everybody's name, it drives me nuts, so. All right, so let's have some discussion. Do we have questions or comments?
I actually have a question. Probably should have asked this of Dr. Baldwin before he sat down.
He has a microphone right here.
Oh, that's true. So as it stands now, we have 39% of the students that are opting for remote learning. Do we have any idea what the average class size in K-8 would look like if we go to an A-B week?
We've talked about this with principals. We're getting finalized numbers. I would, though, make this clarification that the 39% is across the entire district. We have some variance in individual schools, some much higher than that, some in the 25+%. So the 39 is the average across the district. As far as our numbers, I think Ms. Swanger, Mr. Huff can share that information.
One principal was sharing yesterday that she has, one grade level has 20, one grade level has 50. So dividing staff out to make those numbers reasonable, because we have to remember those students will return to the classroom setting and fall under the ADM requirements. So they're looking at those very carefully, and it depends from school to school.
And we would still be, if we are in Plan B, we would still be expected to have that 6-foot distance.
Yes, absolutely.
Which could definitely limit the number of students we have in a classroom.
And Mr. Huff will tell you that 11 to 14 is the average number of spaces inside a classroom. However, Dr. Baldwin and I toured a classroom that just by the configuration of furniture in that room, it would hold 8 kids, 8 students at one time. So really looking at each space and making decisions on which students can fit in that classroom with 6 feet spacing.
Hear you? Okay, the fire code. Okay,
Yeah.
thank you.
Principals have done a great job planning for each space because every classroom space is different throughout their buildings.
Other questions or comments?
I have a question for Ms. Swanger. The online content, the instructional delivery via the online model, I think we all agree, and even in your comments, you mentioned that obviously the traditional face-to-face instruction is strongest. It gives you so many options. But with the online model, can you tell me what adjustments have been made to what we experienced from March 13th forward to the end of the past school year, and what to expect in the upcoming school year as far as the accountability of the student, the accountability of the instructor as well, the delivery, the rigor, and just would you share with that?
Certainly. I think we have to go back to what happened when we were remote very quickly. And we allowed teachers to set up their schedules in combination with their grade levels or their professional learning communities and decide when they would contact students and when they would have meetings. And sometimes there were so many things happening at one time in the schedule, it was difficult to monitor for some of our administrators. So to combat that, we have said, for example, middle and high school students, they will be synchronously on live teaching with their teacher the first 30 minutes of the class period. So for example, if I am a 9th grader, I am expected to log on at 9 a.m. and stay logged on live instruction with my teacher from 9 to at least 9:30. It might be 9:40. And then I go and I do independent practice. And then at 10 o'clock, I come and I log on and I'm engaged with my second period instructor. So it will follow that pattern. So there's daily accountability. I think that the structure of the scheduling and looking at research, looking at summer learning that we've all been involved with to provide the best guidance to our schools. We've done that. We are giving them simple schedules so that we can really be tight and make sure that the academic time is provided. We are also looking at the standards, and we have to think about what happened as of March 13th. And we know there are gaps in student learning, and how do we address those gaps while still moving forward with this year's content or this course content? So we have really had to look at the power standards for my North Carolina Standard Course of Study and then make sure that we're addressing those first. We've got to front load because, quite frankly, we don't know what would be lying around the corner in October or January or March of next year. So we're really targeting specific lessons that are very rigorous and front-loading those to our students immediately while still filling in gaps from last year. And our teachers did a terrific job last year. I can't tell you how proud I am, but none of us had ever taught 100% remotely. We've done a lot of studies since then, and we've heard from them what worked well, what would we like to have shored up. We also have to remember that the state was very gracious, and students knew how gracious the state was in terms of grading, in terms of course credit, and we know we had to do those things for a reason. We were in an emergency setting. So now we're going to have accountability, coursework will be graded, live instruction daily, frequent deadlines that need to be met, and then having our teachers and our staff inside the school building so that principals can be a part more easily instead of just logging on and seeing it from an instructor point of view, but actually be in the classroom watching a teacher online with students or watching a teacher and coaching a teacher when they're working with groups of students. That feels more like a professional environment that we can better meet student needs.
Thank you.
I would just reference what Mrs. Swanger said regarding synchronization. I think that is an absolute key, and I appreciate that question because we are in a different place in time as we begin this school year, as we were essentially forced into the last 3 months of the 1920. But the synchronization is important because, again, we can't read the crystal ball. We're not in control of COVID-19. It essentially controls our responses. But the thought is we may find ourselves this school year in multiple transitions between these plans. So we must synchronize what we're doing to the best of our ability so that as we transition, we don't have a group of students the same age that could be in one particular level of learning as compared to the other. And I echo what our teachers did the last 3 months of the school year being put in crisis management was outstanding. But my expectations as superintendent, as we start this school year, we're going to have a much better model because we've learned from that. And as good as it was under those conditions, it's going to be much, much better. The accountability is going to be much, much higher. But the synchronization is an absolute key to it. And our teachers collaborate so well already. That is as an old educator in this business, that's one of the things that I have seen continue to improve across our faculties and staff. They do a wonderful job, and that collaboration is part of that synchronization as well. Thank you for that question.
And one other additional fact about the synchronized teaching, those lessons can be recorded, so it allows students and families to replay, to revisit, especially if I didn't get it the first time, I have something that I can go back to, whether it's a recorded session from the teacher or the Zoom or the conferencing tool was recorded for later use.
Other questions?
I have some
Madam Chair?
comments. Go ahead, Pat.
No, somebody else was ahead of me, go ahead.
No, you go ahead.
It's been difficult to hear a lot, so if I ask some things that have already been answered, my apologies. Just bear with me. Dr. Baldwin, I think you said right now we have 39% of our students who have indicated they're going to be virtual and have committed to that for the first semester across the system. Is that correct?
That is correct, across the entire system.
So if we go to this Plan C or the recommendation today, be beyond, what is the expectation of physically where our teachers will be located each day, and in conjunction with that, their children who are in school of school age, or even not school age, depending on how this thing plays out. But what is our system's expectation at this point for how that day is going to work for our teachers each and every day?
I think if I understand your question, Mr. Bryant, from a physical standpoint, our expectations is as we move into this Plan C or remote learning, our expectations is our teachers would be in the building. We had an option in place for the solid B model for students and children of teachers K-12, that they would have the option to remain over the entire period of time. As we transition out, our thinking at this time, because again, as I said, childcare is a huge issue, that we are looking at options for children to possibly, of teachers to be in that school building and classroom, although again, all regulations must be respected. Face masks, spacing, because they are our essential employees in the school system. So that is our thoughts. We're still trying to work through that with our principals, but that is the direction that we certainly would like to head in recognition of the challenges that this is going to bring to our essential staff in the school building. Did that answer your question?
It does. I'm concerned about, I'll just say it. I've got a wife, a daughter, and a future daughter-in-law that work in Buncombe County Schools. And nothing is more important to me than their health and well-being, as well as it is for all of our people. I felt up until probably this weekend, Major League Baseball has changed my mind. I felt up until this weekend that I thought we could, as a school system, safely and appropriately implement Plan B. My concern in switching now to where I think we're headed is accommodating our workforce, their children, being in the building. And I get it. I'm all for everything about what we've already decided with masks, et cetera. But my concern is, we're going to bring kids into our buildings now for 2 weeks. And if we're advocating and looking to go to Plan C, be beyond, as it's being called, we're still bringing kids into the building for a couple of weeks. I just don't know how that matches up realistically from a safety standpoint of not bringing people into our buildings in greater numbers than just the teachers being there. So I'm trying to, and maybe one of my fellow board members can help me with that, or Dr. Baldwin or whomever. That's my struggle right now as I've thought about this over the weekend.
Go ahead.
Well, I'll certainly yield to any board member that wants to respond to that. But again, I go back to, we have to remember, that as these buildings open under B, there are some very strict guidelines regarding the mask, the temperature checks, the spacing, and all of that will be followed to, again, the best of our ability and enforced. So that would be, certainly the direction I would respond to. I certainly understand your concerns, though.
I think it's critical that a student and a teacher establish a relationship. And we know that we can do it virtually if we have to, but it would be best case to have that student in front of me so that you would understand the expectations. I can make sure that I can see you access the curriculum that you're going to be accessing daily to make sure that it works in a very systemized manner.
Mr. Huff, did you have?
Mr. Bryan, I just had a few things else that popped in my mind that we're also doing. I'd like to add to those in answer to your question is that we have nurses at our schools. We have CNAs that are there to help guide us along the way. And you've heard us say already, we're in constant communication with the Department of Health and Human Services. One of my things that I think about as we move forward and as students come into our buildings is the nature of safety and drills. One of the things that I asked our Jump Start to do for us, and they were only there for 2 weeks, so the schools could have done a fire drill. I asked them to please do a fire drill because I wanted to make sure that as they move outside and as they are outside, that they can practice good 6-foot distancing. And the response I got back and the pictures I got back was fantastic. The teachers at Jump Start actually gave the double arm interval as they were walking and as they positioned themselves outside. They came up with some very catchy phrases for the young students. They called them their social distancing wings. And like I said, that goes hand in hand with just saying double arm interval as you travel. So I will say from a safety standpoint and security standpoint, all the things that our auxiliary service teams, to include Clark White, Barry Pace, Tim Fearley, and Elizabeth Payne, all those folks have put good measures in place to make sure that as we come into that school building, starting with buses and screening and temperature checks, when you set foot in that building with temperature checks, you see markings on floors that keep areas maybe for the commingling, keeping them down certain sides of the hallways. You've got hand sanitizers that are located in several places. When you walk in the office, you see the plexiglass that's up. When you walk in the classroom, you see the distancing. So I just wanted to just follow on with a few additional things that we hadn't mentioned in all the things that we said. And not to mention, we're working with our communications to actually give a good visual using video so that parents and community members and students, before we get to when they come back in the buildings, they can see those things and get a visual of those safety measures.
Thank you.
I think one final thought, Mr. Bryan, is that I think, again, and I've said this before, this is, I've received quite a few emails, and if there's one common theme, it's we're glad you're making the decision. Because it is an incredibly difficult decision. And this board has, not only in response to COVID-19, but you've always shown propensity for putting safety and health in front of everything else. So I know that's what will guide your decision. But I also want to put a reality out there, because we do not know what is around the corner. And moving to a remote learning platform for all students, in my opinion as superintendent, translates to we're going to have a loss of some of those students because they just do not function without the support that can be provided in that classroom setting. Now, again, we are in a pandemic. We are in a crisis. And I guess some things, you have to balance them out. And I know you will do that. But I also think, and as I talk to you about highly vulnerable populations, that regardless if the decision is to move entirely to Plan C, which is certainly your prerogative and your option, that we have got to commit ourselves, in my opinion, to represent those vulnerable students out there and those populations that are going to fall by the wayside if we remain in that model for a lengthy period of time, which certainly, as we've talked, public health officials, could be a possibility.
Madam Chair, may I piggyback off Mr. Bryant's question? I concur with Pat, especially in light of what has happened with Major League Baseball. And I have a question regarding what is our plan if we were to go straight Plan C, not Plan B and beyond? How would we begin the school year then?
We would begin with the virtual Meet the Teacher so that families are invited to attend a video chat with that teacher, learn as much as we can learn in that dedicated amount of time. We would then set up appointments for small groups of children to come in and get those devices and have a teacher help them access it and then go back home. Much like we did with Minimester. If you recall, we had high school students come to Inca High School campus at a specific amount of time. They spent about 45 minutes, got transitioned, and then began to work remotely from home. And then they're completing Minimester actually today, and we'll have several graduate tomorrow evening. So we will do whatever it takes to make sure that kids have what they need, if you so choose to move to Plan C.
That objectively, looking at the metrics that I was reading this morning, Buncombe County is now up to over 1,400 cases. We look at what's happening in Texas, where approximately 7,000 children have tested positive for COVID. Same thing in Tennessee. And my question that has just weighed on my mind for days and days and days is, if we are, like Pat said, bringing students into the building, we are taking a risk. And I do understand the importance of having that relationship with a teacher, but I also recognize the fact that we are taking a huge risk by doing so.
I understand.
And I can be very subjective about this. I have a young niece who is supposed to start high school this fall, and that is supposed to be, it's one of the most exciting things to ever happen. I have a sister who is immunocompromised. And personally, I worry about that. And then I look at this entire BCS family. We are a family. And we have to do and make the best decisions to keep our family safe. And I appreciate and respect the hard work that all of you have had to do and have done to this point. But I want to be able to put my head on my pillow at night knowing that a decision that I made ensured the safety of everyone in this community.
Thank you.
Yes.
I'm coming from a very different place. And it's not that I don't value safety, and it's not that I don't value every single person in this school system, teachers and students alike, and everybody else, bus drivers and school nutrition staff and social workers and everybody. This is about killed me. I'm somebody who likes clarity and decisiveness. I like knowing what's right and go in that direction, by golly. And as we keep hearing, there is no right answer. And there's nothing simple, as we keep saying, there's nothing simple about this decision, no matter what we do. And everything is so intensified at this moment. The headlines, it's all just amped up, and the lines we're seeing and the number of cases, and it's just getting worse and worse and worse, and the fear is just as much a pandemic as COVID itself. And so I keep asking myself, what does it mean to have courage now? And what is my role as a leader in this community, in this school system, knowing that I'm a big Brene Brown fan, and I really appreciate her wisdom. And recently I heard her say that fear does not equate to danger. And just because we feel this terrible, terrible fear right now, it doesn't necessarily mean that the danger that we're in is the same as the fear we are feeling. And what I've heard from our local health leaders, as well as top epidemiologists from around the country, is that if we wear our masks, if we keep our distance, if we wash our hands, if we sanitize the surfaces, all of those protections are additive. So each one adds on to the other, adds on to the other, adds on to the other, until we are quite well protected if we can manage to authentically do that. So, and I hear that more than 60% of our parents want to send their children to school. Their most closely beloved children in their house, who they're kissing every morning and kissing when they put them to bed, and they feel like it's best for their children to be in our classrooms. At the same time, I love teachers. I love them individually. I love them collectively. I spoke with them on my way in here. I made sure that I went and parked in the area where they were gathering outside this building so that I could talk to them. There were people there who I have known for years, and I made sure that I spoke to them. Our teachers feel undervalued. They feel unappreciated, and that's coming out so much with all this intensity now, is because for years they have felt unappreciated, and now it's all coming down to this point and this vote, and they feel like, with my vote now, I tell them how much they matter. But how much they matter to me is that they are essential. They are the doctors in our hospitals. They are the firefighters. They are the ones that are going to keep our kids on the path to the future. And there are health risks of not having our kids in the classroom. There are long-term health risks of that second grader who does not learn to read now. So I've just been sitting with it. I've been wrestling with it. And for me, like Pat talks about being a country boy, I'm a country girl. I grew up next to South Toe River. I think about the three-legged milking stool of learning, mental health, and physical health. And all three of those are critical in my mind. And the stool itself needs to be balanced for the present and for the long term. And we've all said that having those kids in the classroom is the best way for them to learn. We don't know if we're going to be able to feed them if they're not in the classroom. And the mental health piece, as we all know, is just tremendous. We've all been traumatized by this virus. On top of all of that, and perhaps even larger than that, several weeks ago, we as a school system issued a statement of support for families of color in our community. And we are living in a pandemic of fear, inside a pandemic of COVID, inside a pandemic of racism. And I am trying to learn what I can learn to become an anti-racist person, to become an anti-racist leader. And so I am thinking about those children and families who this COVID pandemic has affected them disproportionately. And so it is sort of a two-sided thing. Do we bring them back together? But then again, that gap, as Dr. Baldwin has said, is just going to widen and widen and widen for that same second grader whose mom needs to go work at Burger King, because you can't telework at Burger King. And who is going to help that child get online? Who is going to help that child learn? Kids who look like my kids, they'll be fine. They're not the ones I'm most worried about. But these kids are African American kids, are Latinx kids, are kids who live in families with low wealth. They are the ones who are going to suffer from this decision. And I have to think about this much bigger picture. And even as the numbers are rising, I have faith in masks. I have faith in distancing. And so my prayer is that we can safely bring kids back into the classroom as soon as possible. And I know that this is an incredibly hard decision also for my colleagues on the board. I fully expect to be in the minority in voting against this for this reason. And I respect all of you, and I want to make sure that you know that no matter how we go forward, we will go forward together. And I will support everything that the school system does. I have concerns about if we are remote and then we bring in small groups of kids, how segregated is that going to end up being? What is that going to look like for our school system? What message is that going to send our children? So I just want to raise these larger issues because I feel like we need to consider the world that we live in, the pandemic of racism that we live in every decision that we make. And I know that we have had lots of requests to talk on this board about Confederate flags in our schools, and I'm hopeful that we will do that in September, as we've discussed. And symbols are important. Systemic racism is also rampant, and thinking about who we prioritize in all of our decisions is really, really important. So I will step down off my soapbox. I appreciate you giving me the chance to speak my truth. And so that's why I'll be voting against this.
Thank you. Other board members?
Madam Chair, I'd like to also make some comments, if I may. And I'm going to try not to be emotional.
Will you take your mask off so we can hear you?
Sure. Is that better?
Yes.
So I'm heartbroken that we are sitting here today having to make these decisions because I wanted nothing more than some sense of normalcy for our students and staff, community. We can't have that. And there's going to be a lot of firsts that are missed. And that breaks my heart. We can't have that. Over the last couple of weeks, I have personally seen increased numbers in our hospitals. Those numbers are not going down. Our percent positive has continued to rise. And I'm just pleading with our community to set aside whatever political or personal feelings they have. And please, please, please practice 3 W's. Wearing the mask, waiting the 6 feet apart, washing your hands. No matter what some Facebook keyboard warrior may be telling you, that is absolutely the best way to help prevent more increases in our numbers. This is what has been strongly encouraged by our local health experts and those around the world. Again, health experts with years of experience, and they're not sitting behind their keyboard on the internet. From today, we have 9 weeks. 9 weeks to start to change what COVID looks like in our community. We have 9 weeks, if we vote for this, to get it right and get our kids back into a classroom. I think that ultimately that's what we keep hearing loud and clear. And all I can say is this is going to take every single person in this community to do their part in order to safely see that happen. So again, I just am asking for the community to please support our students and our staff. Do the right thing. Let's get these kids into a classroom as soon as we safely can. Thank you very much.
Madam Chair, I would like to make a couple of comments. I echo what all of my colleagues have said, and I can agree with what they say, but it's contrary in some elements. So with that, I would say that through my adult career, I spent a lot of time in emergency medicine, teaching paramedics, working in the emergency department, Dean of Allied Health and Public Services at AV Tech, and Amy Churchill also has spent a large part of her adult career in healthcare as well. And we have seen infections. We have seen patients who are in dire straits in ICUs over the years. And we're very cognizant of what could happen. However, echoing what my colleagues have said, observing the 3 W's seems a proper way to mitigate that. And then adding to that screening by temperatures, wiping down surfaces, sanitizing, doing all of those steps, it does seem to reduce the risk. However, I go back to when I was in school, and I'm sure Amy had the same lectures. One of the first days, you'll have one of your department heads or dean of programs come before you, and if you're going to a health program, they say the first rule of medicine is do no harm. Whatever you do, do no harm. And the second rule should be followed is if in doubt, treat your patient. And I think about that, and I try to apply that to our situation we're in now. There is a lot of concern. I've received much email and from faculty, from instructors, concerned about going back into the classroom just now, particularly as we see the spike. And I want to reiterate what Dr. Baldwin said. This is a moving target. I'm looking right now at the Buncombe County Health Department's information, and I can tell you that on July 1st, that was the day after we had met as a board, there were 12 new cases reported in Buncombe County. And if I look as of on the 26th, there were 45 new cases reported, and that was on a daily. So you can see that the numbers have increased. That is concerning. And I think the reason it increased is because we drop our guard. We reduce the concern, or we just relax ourselves, and we start meeting together, and we start going out in public and not following those steps that we do to protect ourselves. So, but with that in mind, I think the decision we made on the 30th was appropriate for that moment in time. It was a snapshot in time. Now we're faced today with a different snapshot, and the snapshot is the numbers have increased. And I think that going back to my colleague, Mr. Bryant, his concern about those kids going back even for the 2 weeks, I suppose you can, it's legitimate concern. But I also hear the other saying that it's important for the instructor and the student to have that opportunity to meet and have that discussion face to face and get them uploaded and on board with a new format for the online instruction. So I simply say that to say that I feel like that being a prudent board, and I think in legal terms it's the test of the reasonable man, is what we're asking them to do. Is it reasonable? And I think there's a lot of angst about going back whole, and certainly we're not considering that. But at this point, I think what has been outlined in Plan B is palatable to me. Would it be palatable if we said, well, let's go to Plan C and have the instructor meet with his parent and student individually? That would also be palatable to me. But I simply say that we need to do no harm. We need to be reasonable in our decision. And if in doubt, take care of what's important to us, and that is our students and our staff. So thank you.
I keep looking at this attorney to make a comment, so I keep going, sorry. This has been, without a doubt, the most difficult decision I have ever been faced with in my life. And it has usurped my life. But all that being said, and as you all know, I come from a teacher background, and having a relationship with my students it was always paramount in my being, and continues to be with those that I had an opportunity to work with. But if I made a decision and just one person, because of my decision, one person succumbed to this horrible COVID-19, I would have a very difficult time dealing with that. So that being said, I'm going to support Be and Beyond because I believe, as Max has said, this is one moment in time, and I believe that we can move through this school year, this ever-changing school year, and reevaluate our situation as we move on. And I also want to take this opportunity to thank all of you on this board for your dedication to this. We have met with Health and Human Services, we've met with the county manager, we've met with each other. We have been diligent in trying to make the best decision. And I commend all of us for doing that. And the administrative staff for the work that they've done. It is a prime example of integrity and the responsibility that you have taken with this job. Do you have a comment? Okay, I'm going to call the question and ask for people to vote. And what we're voting for is the plan that was presented to us today, which is the reentry plan that we're calling Be and Beyond. All right, Peggy Buchanan.
I vote for Be and Beyond.
Thank you. Pat Bryant.
No.
Okay. Amy Churchill.
Aye. I'm voting for Plan B and Beyond.
Okay. I just can't hear you. Cindy? Donna Pate?
No.
Max Queen?
Yes.
And Ann Franklin. The motion passes 4-3. I think I made my closing comments when I commented on the Be and Beyond. So at this time, then I would have a motion to adjourn.
So moved.
And could I get a second?
Second.
And we need to vote. Peggy Buchanan?
Yes.
Are you willing to adjourn? Pat Bryant?
Aye.
Amy Churchill?
Aye.
Cindy McMahon?
Aye.
Donna Pate?
Aye.
Max Queen?
Aye.
And Ann Franklin. Thank you all for all the work that you've done and continue to do. This meeting is adjourned.